So I want to welcome all of you to our virtual town hall. Thank you so much for being here. My name is Dr. James Simmons. And before we start, that's a good start, right? We just kick it off right away, James. I think that's actually the perfect opportunity to bring up something that I really want to talk about before we even get going, is that this is an opportunity for an incredibly diverse set of voices to be heard and to be listened to. And we're not always going to get the language right. I think the point is that we are trying to, and that we are having a conversation. And the gestalt of this conversation as we get going, by the way, and you're going to get to know the folks who are in front of you, by the way. We'll do some short introductions. I have some very specific questions for folks that, the whole nine. But I think what's really important here is that this conversation, the bottom line for this conversation, is to talk about how we move towards problem solving, how we move towards finding solutions for the entire conversation of systemic racism, the intersection of that with the LGBTQIA+ community and other individuals, persons of color, how it specifically relates to police brutality and the killing of Black individuals, all of that also in the workplace, okay? So this is gonna be one of those conversations where we go there. But just like I messed up a little bit in kicking off this conversation, I think it's really important to know that this is a safe space. It is okay to mess up a little bit. It's also okay for you to get corrected. So if there's someone in this conversation who needs to correct you or says, that was a great try, let's work on some new language, that is what this is all about, okay? And Dr. Robin knows, Jarrett knows, I happen to know those two individuals, but that this happens often and frequently, and I think that's what makes a really lovely, wonderful, juicy conversation. So with that said, thank you again for being here. I will try that again. It is wonderful to bring all these amazing voices together. I want to thank Dash Radio in particular for giving us this platform, as well as Providence, of course. And so before we launch into too much, let's actually meet our panelists and give everyone a sort of an opportunity to say hello. So again, my name is James Simmons. Apparently Dr. James Simmons. This is new. I just got my doctorate. I'm a nurse practitioner. I practice here in Los Angeles. I also am the co-host of a nationally syndicated LGBTQ talk radio program on Channel Q, which is a part of the radio.com family. And I have my own online thing, Activist, as well. So that is me. I'm the moderator throughout this conversation. We also have some amazing, incredible people here, like Jarrett Hill, for instance, who you probably have seen in many different places: MSNBC, NBC, CNN, the New York Times, Variety. He also happened to used to host the radio show that I host now. So Jarrett, say hello, please.
You make me sound way cooler than I feel most days, but thank you for that. I'm Jarrett Hill. I'm a politics and pop culture journalist, the vice president of the National Association of Black Journalists here in Los Angeles. And I host a show called Fanti with new episodes that come out every Thursday, where we talk about the complex and complicated relationship we have to our politics and our pop culture. So,
excellent, very good, Jarrett. Super excited to have you here. I'm also super excited to have Dr. Robin Henderson, a psychologist and chief executive behavioral health for Providence, Oregon. Very, very fancy title, Dr. Robin. Say hi.
Hey, everybody. It's a pleasure to be here. And Dr. James, as always, it is so good to see you. And I would be remiss if I didn't put in a plug for the podcast that we host through Work to Be Well. That's Talk to Be Well, that we host every Wednesday, where we listen to teens talk about real issues, mental health, racial disparities, and even the importance of getting out to vote.
Yes, which will absolutely come up in this conversation, I am sure. And this fall later on with some of the initiatives that Providence is also working on. So thank you, Dr. Robin, for being here as well. Beverly Murray. Beverly, you did, right before we started recording this conversation, you had the best introduction of yourself. And I was like, man, I wish we were live with this. So Beverly Murray, please repeat that and let everybody know who you are.
Sure. I want to thank you for the opportunity to be here. And my name is Beverly Murray, and I'm the Chief Human Resource Officer for Providence St. Joseph's Medical Center in Burbank, Providence Cedar Sinai Tarzana Medical Center in Tarzana, And I'm also one of 3 chairmen of the Black Caregiver Resource Group at Providence in Southern California, and I'm very happy to be here.
Thank you. We're very happy to have you as well. I love that when the title just keeps going, by the way. I am this and this and that, and the tri chairperson. I love it. That's fantastic. New worlds we're living in. This is great. Next is Jorge Melendez. Jorge, I believe you are the leader of the Providence Latinx Caregiver Resource Group, if I'm not mistaken. Please say hello and introduce yourself.
Yeah, hello, and yes, so I'm the chair of the Latinx Caregiver Resource Group here at Providence in Oregon. I'm also the senior manager of infectious diseases and endocrinology here in Oregon.
So you've been just a little bit busy these last few months, infectious diseases, to say the least. We also have Michelle Manning-Herman, a part of, and correct me please if I'm mistaken, Michelle, you are a part of, or you are the chair of the Providence Women's Caregiver Resource Group?
I am the events chairperson for the Providence Women's Caregiver Resource Group. We have a steering committee of a number of people, and I am over the pillar for events. One of the things that we're trying to do is driving gender equity, amplifying the voices of our women caregivers, and establishing a community where they can have safe conversations and network and things along those lines. So,
excellent. Safe conversations and safe community is a theme that's going to come up pretty periodically throughout this conversation. So thank you for kicking us off with that. Really appreciate it.
Mm-hmm.
Last on the panel here, but certainly not least, Peter Mann-King, LGBTQ plus Caregiver Resource Group. Peter, please say hello, introduce yourself.
Hi all, thank you for inviting me to join this conversation. I go by he, him, his pronouns. I am a member of the Swedish LGBTQ plus Caregiver Resource Group, as well as starting a new initiative at Swedish focusing on LGBTQI plus healthcare as a system. So excited to engage with our caregivers, patients, and communities moving forward into this year. I also serve as the co-chair of a local LGBTQ plus center, Gay City, and so bring that as well. But excited to participate in this conversation, and thanks for having me.
Thank you for being here. All right, so we have some formalities out of the way, at least to who we are. And now we're going to get into a little bit about why we're here. Before we do that, though, I think it's been really important in having had the privilege of having some of these conversations on an individual level, as well as having these conversations on a larger scale, hosting things on, nationally syndicated radio program. I was fortunate enough to host a Zoom in June around the intersection of Blackness and the LGBTQ community, in particular about the murders of trans individuals, that ended up garnering nearly 1 million views. And all of those levels of conversation, I think it is incredibly important to level set before we dive into those. So one of the things I like to do, I kind of already brought up language and how it is critically important that we all work to use the right language and continue to do that, but knowing that we're gonna make mistakes. That's okay. Be also okay with getting corrected with that. That's how we learn. So I wanna set that as well. Also, I have some very specific questions for some very specific people on this panel, but that doesn't mean that nobody else can talk. In fact, we want everybody to talk. This is a conversation, okay? So I might jump in occasionally. I might pick on some of y'all. I expect some of you to jump in as well. I also expect, if you're like, James, that's a great point, but we're not ready to move on, like slow your roll, like jump in, okay? This is a conversation for sure, all right? And the last thing I like to do before we get started is actually everyone watching and everyone on the panel, I can hear it in my own voice. We're all a little pressured right now. The state of the world, everything going on, the times that we are living in right now, just living and breathing and surviving and waking up and deciding what we want for breakfast and trying not to guilt ourselves because we didn't work out. And then having these conversations about race having these conversations about systemic racial issues, the intersection of that with the LGBTQI plus community. All of these things that we're about to launch into are heavy, and a lot of us deal with that on the daily. So before we get into this conversation, I feel like I get to be a little bit selfish, and I want everyone to take 10 seconds with me and just breathe. And when you breathe, I learned this from Scott Turner Schofield, who is an incredible activist in the transgender community here in Los Angeles and abroad. When you breathe, take your hands, put your fingertips together like this. If you are able to do this, put your fingertips together and just keep them there. You don't have to do anything with it. But this helps complete the circuit of our breath, is the easiest way to describe this. So put your hands together and just breathe. However that works for you. Big breath in, big breath out, just for 10 seconds. Nothing else matters right now, just breathe. 10 seconds kind of feels like a long time, doesn't it? I think it's hard. We don't often do that. We don't often take 10 seconds just for ourselves to just breathe, just to reconnect with ourselves and the environment that we're living in. So speaking of the environment that we're living in, we're all here on this panel and here watching this conversation right now, listening to this conversation, because we believe in the importance of creating a sense of belonging for everybody in our respective communities, workplaces, schools, etc. Social belonging is actually a fundamental human need, and about yet 40% of people say they feel isolated, particularly in the work environment. So this environment that we are in right now, this madness with widespread racial and social injustices, has created this moment in America and with Americans, and I will expand that to say the globe. And I think we all know it. I think we all feel it. That's why I grab right here. We feel this moment that we're in right now. How we respond in this moment will shape the future. And it has an impact on our overall health and mental wellness. It really does. I just talked about that, about us breathing, about us coming together. This is impacting us on the daily and wherever we work, whether that's here in my dining room, whether that you are someone who is going in, or when I go to the hospital, or if you're a frontline worker, it's impacting all of us. So how do we cope with this? How do we embrace uncomfortable conversations and create positive changes, right? And I think that's really key. I want everyone to really focus on that. These conversations are often uncomfortable. They're supposed to be. We got to change things. So our conversation today is going to focus on what the future is going to look like. How can we be healthy, and how can we stay healthy with ourselves and our families and our communities while we continue to make the change that needs to be made and have these conversations going forward. So with all the folks here, Dr. Robin, you knew I was coming to you first. You knew I was going to pick on you first because we're talking about mental health and all of this. So it's no secret right now, everything happening with this pandemic and racial justice is really impacting our mental health as much as our physical health. So what communities or populations do you see in your work are more affected than others? Although that might seem like a simple question, it might not be, particularly because they have reduced access to healthcare resources, are being treated differently.
You know, Dr. James, thank you so much for how you frame this conversation and really opening right up with what are the vulnerable populations. And I can tell you right now that the vulnerable populations are young people, are incredibly vulnerable right now. The normal routines, the safety of school for our young people who are living in families suffering from physical, emotional, all different kinds of abuses. Those kids have no outlet. They're trapped basically in that family because that's where we all are, and they're not able to go to school and reach out. I'm especially concerned about our LGBTQIA, especially our transgender youth. I am the mother of a transgender college student who is enjoying her first semester at college. Mm-hmm. And I'll tell you, when I talked to her Saturday night, she was out at a protest and she had used her chalk on a sidewalk and got a ticket from a police officer for chalking a sidewalk. Mm-hmm. And I said, did anybody else in your group get chalk, get a ticket? And she said, no, Mom, they only gave tickets to the transgender ones. Mm. And as a parent, that just, strikes a chord of horror. I am very, very concerned about our Black caregivers, our Black families. I know that I live in Portland, Oregon, which has been the seat of much, much, much social unrest. We are going on 90 plus nights of protests and things like that are not what the Black community intended, that are not always about Black Lives Matter, and that have taken attention away from what is a powerful and important conversation that has got to happen in this community. The history of systemic racism, especially in Portland, Oregon, is horrifying.
Mm.
And I am very concerned because there's not a lot of people of color in the mental health community in this town.
Mm.
So where do you go and who do you talk to and how do you start the conversation?
And are you seeing an uptick of people, particularly individuals of color, Black individuals, and individuals from the LGBTQ community seeking mental health resources now in the middle of all of this? Or is it we're still having that age-old lack of access to care conversation?
We've done everything we can to open up care. I have a wonderful team of psychologists who are in primary care who, when COVID hit, we all went virtual. And that was the biggest gift to access you could ever have.
Mm-hmm.
Because once we went virtual, that meant all of a sudden people were available in very different ways at very different times. So we rolled out a concierge service that is available 7 days a week. We're able to get people in usually within 24 hours, at the very latest within 72 hours. So I will say that going virtual has increased access. The problem still remains, though, that even within my team, I would venture to say that probably only 10, maybe 15% of my providers are people of color. 10, 15% of my providers are LGBTQIA in that category. So as a profession, mental health has got to do better. And I think one of the ways that we've got to do better is by creating better pathways for vulnerable populations and marginalized populations to even get access to the education to get there.
Mm-hmm. Absolutely. And that it seems like that might be kind of in pushing this conversation a little bit, Robin, it seems like that's such right. Oh, we're all virtual. This is great. Now it's a lot easier for people to access care. And yet you bring up the point that there's some incredible research around people of color get better health care from other people of color.
People of color.
You need to go to someone who looks like you. You need to go to someone who speaks like you, who you feel like at least visually has had a shared experience that you have. And then you go, it reminds me of the story of the two girls who are using Taco Bell's Wi-Fi to do their schoolwork. And it brings up this conversation of, and their story is great. I think someone started a GoFundMe. It's raised $100,000 for them now, like that's going to their family. That's amazing. That's one family.
Yeah.
But we're in a situation right now where it has expanded. I think Providence was saying earlier this spring that, Robin, you probably know the statistics, or some of you there know the statistics in terms of the percentage jump in virtual appointments that happened this spring because of COVID. It's fantastic.
It's stunning.
Yeah.
It's absolutely stunning, but you're absolutely right. Getting healthcare from someone who looks like me, who has, at least from a visual standpoint, and I can say this, I'm a psychologist by training. I was raised in a biracial family. You would not know that when you look at me. You would never know that my dad's Black. You would never know that. You would never know that my oldest sister is Black, living in Arizona, who right now is struggling with depression and isolation and outright anger and frustration at the political climate that continues to marginalize her. But if you see my picture, and I have this lived experience, but if you see my picture on the Psychology Today website, I don't look like you.
Right.
Even though we share that heritage. I know you and I have talked about this before. We share that biracial identity. And it's really, really difficult. And when I look at, early on in this, I got a call from HR, and HR said, "Hey, Robin, we need your help. We need to know how many Black psychologists do you have so that we can make that resource available." And I thought, how am I going to manage this question?
Right, because there's a lot of layers to that question.
Because there's a lot of layers in there, and it's going to get deep really, really quick.
Right. Do you want the real answer, or do you want the real answer? Right.
Exactly.
Yeah. I mean, I think you bring up such an interesting point about your sister and how your sister is coping with everything going on. And I actually sort of want to shift a little bit, Jarrett. I'm going to pick on you as someone who is a journalist and out there having conversations with individuals and being asked to have conversations on these large platforms, on CNN, on MSNBC, and all these different places. What are you seeing as some of the ways that individuals who are most affected by systemic racism and what's going on in the world right now are actually coping while still pushing for positive change, right? I think there's, sometimes we talk about get off Twitter, or what are all these things, but I think there's this interesting conversation, this intersection about like how we cope with what's going on in the world with these conversations, then also how we're making change at the same time.
One of the things that's been interesting to me, I did this piece for Self Magazine just recently, where I was talking to different journalists, Black journalists, about what it's been like to cover the month of June when we were coming through all of the different protests that were happening around the country. And I'll say that one of the things that was illuminating for me was how it actually helped me to talk to these different journalists from around the country and to hear how they were coping and to know that I wasn't the weird one. I also did a panel with 5 Black men who covered these stories every day and talking with them. And I was surprised that I wasn't the only one who, for instance, was not watching all of the videos of police killings, right? Or that was having difficult times watching the news. And I'm a part of the news, right? And so it was interesting to hear them say like, oh, I haven't watched those videos, or, oh, I'm not engaging that, or I've really stepped away from my social media, or I've turned off the television. Working with the National Association of Black Journalists nationally and both locally, I'm in communication with a lot of journalists here locally and nationally, and having those kinds of conversations about the ways that we're coping, but also the ways that we're hearing people are coping or dealing with all of the things going on. And I think that a lot of it has to do with being able to unplug from all of the information that we're getting, because oftentimes it is really draining to continually hear these things again and again and again. And I mean, for myself, I've openly talked about depression and anxiety and those things. I think just being able to talk about it with someone has been really helpful in the moments when it's the most difficult. And I know for myself, having a therapist has been immeasurably helpful. Even when I'm like, okay, now watch it, because my therapist a couple of times I'm noticing a pattern that's developing. I'm like, I ain't here for all that, okay? Calm down.
That's too much.
But it's been really helpful to hear from other folks what they're going through. And I think even if just discussing it with other people, it's been really incredibly enlightening for me and encouraging for me. And I know that for many of us others, it's been that same thing as well. I know also people are finding other things that they are doing. I know for myself, I have been baking a lot. Like I have baked many a cookie, many a banana bread, a challah that I baked. Like I think people are finding various different ways to be able to, make themselves feel better. I know that a lot of folks are out, getting plants and things like that. And there are myriad ways that I've found just talking with different folks that they are coping, even if they are not aware that it is coping. I think sometimes you realize that you're coping after you've been doing it for a little while. And that's been one of the interesting things as well.
I wonder your take also, Jarrett, and everyone listening, by the way. I had a really interesting situation come up with a friend who is white, and has always been on the woke side of white. I'm just gonna be real with y'all, by the way. Providence knows me by now. We've been doing this for 2 years. I am a very real person, whether I am hosting or on the phone, this is what you get, right? So I'm just gonna be real with y'all. So he was on the woke side of white, very woke. And through everything that's gone on, doing and saying all the right things. Man, I thought I knew, and now I don't. So now I need to go do the work. Not asking me to tell him what to do, just going to do it. Like all the things we want, right? Had already read all the white fragility books, had already done all that stuff, doing the work, and is incredibly depressed right now. Mm-hmm. Like actual, if this person was in my emergency department, I would diagnose him with what I think is clinical depression and then refer him to therapy. Because he is having these battles with his white family who live in the Midwest. And everything that they are saying and their support of individuals and their support of radicalism on the other side and their all lives matter, blue lives matter types of conversations, and some of them even more aggressive than that. And I'm finding it really hard to have that conversation with him about it's okay for you to go for a run. It's okay for you to watch Real Housewives of Beverly Hills. Like you don't have to be in the news all the time. You don't have to be, if you take a break tonight, it's not that you're not part of the fight. Because he feels like now that he's even a more woke white person, he feels like if he stops fighting, he's not helping push the cause. So Jarrett, I wonder your thoughts about that. And then Dr. Robin, obviously, but other folks who've had sort of similar experiences. I think this is a really interesting topic about helping people feel included and coping with everything we're going on and how to not feel guilty when you need to cope.
Yeah, in the piece I was talking about having written for yourself, we were talking about the ways that we are coping, and one of them was turning off the news. And what's interesting about being a journalist is when you turn off the news, you do get the rest of not knowing what's going on, but you also have the anxiety of, I don't know what's going on, right? And so there's a bit of an anxiety that comes along with that. There's a concern about not being a good journalist or not doing your job and things like that. But what we found is that like you need the recharge to be able to do anything, right? If you just keep going and keep going and keep going, you become ineffective and you're rendered, useless. So we all were talking about the ways that like, yeah, it's a little awkward when I turn off my notifications or when I turn it off for a few days or even a week, or if I take a break. But when I come back, I'm able to re-engage it, and I know how to be able to plug in and see what I missed and those things. And I know for myself, it's been restorative and impactful to have a break, to say, I'm not doing it today. I can't engage it today. Or even just an hour, right? To take a moment to take a breath, to do a meditation, to have a conversation with someone. And I think it is important. I know that many people feel that guilt of like, I'm not out there on the front lines holding up a sign and yelling on the front lines. But I think also people need to recognize that there are many ways that you can be a part of the movement, if you will, that it's not just about holding up signs out on the street, but it's also about being the person who's helping with the messaging, being the person who is, helping getting food and water to the folks that are out there, being a person who supports, being a person who is able to listen and be able to advise. There are so many different roles in the movement. If everyone was out there holding up signs, no one would be working on policy. No one would be working on strategy. No one would be working on the message. No one would be working on taking care. So while it is difficult sometimes to step away, I think it's incredibly important to take that time away.
Well, and I would just add in there in the issue of self-care. We are not good at self-care. We are not geared for self-care. And in fact, for many of us, we feel guilty. And I'm going to add another layer in here, and I've got a question for our HR professionals in here. We have in Providence right now, we've got kind of the split workforce. We have we're all in healthcare, and there are the essential healthcare workforce that are in there in this pandemic every day, putting their lives at risk every single day. And there's a large portion of our workforce that is not in the building, whose jobs are just as essential or just as important. But they're able to work from home. They're able to work from other environments where they are not on the front line of risk. And I think there's a dynamic of guilt in there with that population that sometimes we don't talk about in terms of feeling less than. Maybe my own self-care is not as important. How do I maintain and keep my, really that whole sense of being part of the essential healthcare workforce when I'm not out there on the front line putting my life at risk? And I worry about that pocket of caregivers because they think they're at risk for a level of depression and anxiety that some other pockets that we work with are not. And because they're so isolated, that's going to make them at a higher risk for depression that can lead to all kinds of really, really outcomes, suicidal thoughts, and all those other types of things. And they're not around a workforce that's going to see that and help them.
If I can jump in really quickly, I would tell you that we started talking about difficult conversations, and I have a little method that I kind of use for difficult conversations. And I kind of take this house and pretend like I have two doors. And a lot of people like to approach the conversation from the front door, which is, I think I have the answer already. I'm just going to listen to you just enough, so that then I can jump in with the answer and help you out. Good intention, but maybe not the right approach. And then this side door that I call curiosity. And I think it's really important that you take a sincere curiosity into difficult conversations. So the first thing you need to do is ask those caregivers how they're feeling. Take that temperature check, because they're the best judge sometimes of what they're feeling. They might not call it depression, but they certainly might be able to tell you, I feel a little funny because I'm at home and other people are in the workplace. And those of you who work at Providence with me can say this, but this is the way I perceive Providence. We're all caregivers, and we call everybody caregiver on purpose. Words are important. Even if you're not the person who's directly caring for the patient, the work that you do allows that person to provide the best quality care for the patient. And so in using those words, I think it's important that we all are in this together. And the fact that you're at home is about safety, your safety, my safety as a caregiver who does come into the hospital every day, because the fewer people that we have in that hospital, right, the less contact, and we're all keeping each other safe. So I think those messages are important. That approach to the conversation is important. And so I'm hoping that answered the question somewhat, but I think we just need to keep engaging in these conversations.
I think it's such an amazing topic that you bring up as well, in terms of like, we are all caregivers in the role that we're playing, and that you don't have to be at the bedside with the patient in that clinical environment to be a caregiver. And I love that Providence calls your groups, in corporate world, there's sometimes affinity groups or whatever, but Providence calls them caregiver groups. And I love that. And speaking of caregiver groups, Michelle, for you, healthcare, and I know this because I'm in healthcare, right, is a female identified dominated industry, right? Women make up about 70% of healthcare, yet less than 30% of leadership. So can you tell us a little bit about, from a caregiver resource group standpoint, how is your group working on tackling gender equality and gender, specifically female identified individuals, in this space of what's going on in the world right now with your caregiver resource group?
Okay, yeah. We are at Providence incredibly fortunate to have amazing women leaders at the C-suite level, at not only our system level, but also our region and ministry levels. But we can do better. We have to do better, because 30% out of 70% is not enough. The goal for the Women's Caregiver Resource Group, as I mentioned earlier, is to raise the voices of women in our organization. But we also are there to provide mentorship and other opportunities for growth and development, as well as the chance to be seen and have their skills and talents recognized and noticed by our leaders. We've got an incredible chance to grow new women leaders from within the organization. 70% of folks in healthcare are women. Well, then there's 70% of individuals that we can raise up and help them to find those opportunities to network with one another through the brunch and learns that we have. Because we span so many time zones, we've had to change it from lunch and learns to brunch and learns, so that we can have those opportunities to share with one another, not only pre-COVID in person, but post-COVID or during COVID, utilizing virtual space to have those kinds of conversations. We have created those spaces with our pod squads, which are intended to be book clubs except for podcasts, where we'll select some podcasts to listen to and then have a really great conversation around them. We've actually delved into book clubs, especially after the events in May with the death of George Floyd and the rise of systemic racism, or at least beginning the acknowledgement of the systemic racism that we have had in our country, where we've had facilitated book club discussions about white fragility, about how to be an anti-racist, to get people's feet wet into the conversation and the work that needs to be done. Excuse me. Also, for some of the challenges that our women and, quite frankly, all of our caregivers are facing with caring for children and elderly parents while working full-time, oftentimes at home, and trying to not only do your work, but also help the kids with their education and the schoolwork that they have to do. So providing those opportunities for people to get together, to meet one another, and begin to have those conversations. The conversations have been rich, they've been respectful, and at times they've been raw with emotions and lived experiences that help to broaden everyone's perspective. And so, it is an opportunity. I'm thrilled to be able to help in leading and guiding some of those events that take place that can help to elevate those voices.
There's an underlying theme of everything you talked about here about community. And yes. I think that there's this, whether you call it a caregiver resource group, whether it's how you identify, whether it's the group that you're protesting with, whether it's who your chosen family is, there is something about community that really changes everything and allows us to, the whole focus of this is how do we have people feel a part of something so that they continue to be good caregivers, right? For Providence, for ourselves, for our communities. And community is really important. And there's a particular community, Dr. Robin, I'm going to come back to you for just a brief second. There's a particular community that I think consistently gets lost in the conversation, and that is the community of transgender individuals of color. And not only lost in the conversation from the murders that happen, but also the intersectionality of everything going on with homelessness that is rampant in that community, with the stigmatization of sex work, which is often a survival mechanism for individuals in that community, all the way through to language, right, that I mentioned before, and like pronouns. And so you having a trans daughter, I just kind of want to talk about for you in general, in this whole global, gestalt of caregiver resource groups and everything going on in the world, the importance of language and using the right pronouns, particularly for individuals in the LGBTQIA sphere.
Pronouns become part of it's almost like that respect that you see me for who I am. You see me. I have not only my transgender daughter, but one of her friends shortly before COVID, another transgender youth, he moved in with us because his grandmother had kicked him out about a month before the pandemic. And at that point, well, you're in our bubble. You're here. So you're part of the family. And so there's a whole hive of transgender kids who come in and out of this house all the time. And the pronouns are the piece that to them speaks to their identity. And there's a phrase that they use called their dead name. And that's the birth name that many of them had that were identified with obviously the wrong gender. And that also becomes so important because that process of choosing your name, of choosing, your name is the thing that confirms your identity. What people call you is important. And I remember last year, I had the opportunity to speak at Leadership Development Institute in Oregon at LDI and tell the story of my daughter's journey with anorexia nervosa and suicidality and many transgender youth. Suicide is very much a very present thing for our transgender youth. They have the highest rate of suicide, especially our Black transgender youth. And affirming that, telling that story is so important. And at that point, Billy was using they, them pronouns. And it was something that we were very facile with and totally there. Billy just got her court order a couple of weeks ago, changing her gender officially and officially moved to she, her pronouns, which is so huge. But anyway, somebody had said along the way, Robin, you're going to lose the message if you use they, them pronouns. People in the audience aren't going to hear it. And I said, no, that's not how this is going to roll. Because if you want Billy's story, then you get Billy's story the way they intended the story to be told.
Absolutely. Thank you for doing that. And for, I think those small, I know Jarrett has talked about this before and Jarrett's hosted the Fanti podcast before. And I know Jarrett's talked about this on the podcast before about those small, brave moments are collectively the things that start to matter. And so, you can be on this platform. They've invited you to speak. It's a big deal. You're Dr. Robin and you're there. And then they say, well, why don't you go ahead and use Billy's original pronouns? And it would be really easy to say, sure, because ultimately it's important to share Billy's story. But saying, no, we're going to do this the right way. I think that's what's really, really important in this entire conversation. And I think there's kind of piggybacking off of what you said, Dr. Robin, there's, Peter, I wanted to kind of come to you and talk about some of the specific issues in the rest of LGBTQIA. And I both love and hate that we use that, right? The experience of a Black trans woman living on the streets of Los Angeles is not the experience of the gay white man who lives in WeHo, right? So while we talk about the group together, we all have very unique individual experiences within this. So I'm lumping them together for sake of conversation, but please understand my intentions are pure with this. So Peter, if you could just sort of talk about what are at least your caregiver group and what your caregiver group is doing to help address these specific needs of the LGBTQIA community and what's going on in the world now.
Yeah, so appreciate the call out, and I think as the LGBTQI community and plus because there are so many different dimensions of persons' identities within that community, I think one of the most important things that a caregiver resource group can offer all of our caregivers is to be seen in the different intersectionalities that LGBTQI plus represents, and that we aren't necessarily just, those letters either. And so, I know we have representation from our Black and Latinx, and, I myself identify as, a gay Latinx, member of an LGBT community, but how do we connect all of those stories together and also understand that, as you mentioned, not all experiences are equal within our community. And so as a whole, the Caregiver Resource Group really is focused on creating that community, creating opportunities around bringing in support and advocacy at the organization level, especially within the Swedish healthcare system. And also helping to promote and mentor when we're talking about leadership, the leadership of representation of our LGBTQI plus members within Providence and Swedish as a whole, seeing more people making decisions and representing our communities as well within that is, I think, something that our Caregiver Resource Group is really focused on as far as showing mentorship, helping people navigate and grow within their communities across the caregiver spectrum. I will also say it is, one of the simplest things that I think our Caregiver Resource Group and something that the LGBTQI plus initiative will focus on is inclusive language. When we're talking about recruitment, retainment, being heard and seen, going back to the concept of pronouns, making sure that all of our policies that we see, the use of pronouns are center and focused and thoughtful in every communication that is sent out, and that's something that resonates back to the conversation of feeling connected. When I receive a communication via email or over all of the different platforms and I see myself in that communication, I also feel connected with the caregiver community as well. And so I think that's something that the Caregiver Resource Group is ensuring and also helping to advocate that our community is seen, but also that we are interconnected with all of the different groups, especially our Black, trans, and BIPOC community members within the LGBTQI plus community. So thanks for asking.
Excellent. Of course.
James, can I jump in there?
No.
Okay.
Of course you may. Sure, please jump in.
I want to just point out, I think it's really important that when we're talking about language, one of our listeners actually sent this back to us. It was from an episode that we did on allyship and talking about allies and what it means to be an ally and things like that. And the person, the guest, his name is Jarrett Lucas. He happens to be my best friend, but he said that words are stand-ins for ideas. Words have meaning. When we are talking about systems of oppression, we have to examine every word we use. We have to interrogate the ideas that underlie those words. And the conversation that we were having was about the word ally even, right? How the word ally, there's something wrong in the use of that word, right? If I am a Black person and a white person comes to me to be my ally in ending systemic racism, or a straight person comes to be my ally in ending, homophobia or transphobia or any of those phobias, there's something about the word ally that inherently implies that this is my work to do, and you are here to aid me, right? But if we look at that word, if we look at that positioning, it's backwards, right? Like ending systemic racism is the work of white people. Ending the work of transphobia is the work of cisgendered people. Ending the work of homophobia, ending homophobia is the work of heterosexual people, right? And so when we look at all of these different kinds of words that we use, it's important to remember that all of these words mean things, right? They all come from somewhere. They have an intention and a purpose. And it's important to think about those things as we do that. When we think about the pronouns that we use, if we're identifying, Peter or Robin or Michelle or whomever, but also if we talk about the ways that we do that organizationally, when we put out a statement and say that we need to do X or we are blank, if we're the NFL and we're talking about the ways that we need to be better about race and gender, the NFL is 70% black people, right? When we're looking at players, right? So when we say we there, what are we saying, right? When we say we, and when we use that inclusive kind of language, we have to really be thinking about who we're talking about when we're using those pronouns. I think it's really important.
That's a fantastic point, Jarrett. I have multiple points on that one. And I think this is a concept that's really difficult for a lot of people to grasp. And there's even an intersection there of the Caregiver Resource Group, and then being asked the question about, for instance, like I teed up the question with Michelle, like how, Providence statistics for women in executive roles actually happens to be much better than the national average, right?
Yeah. Yeah.
So 78% women are caregivers, and more than the majority of executive level individuals in Providence are women, identify as women.
Mhm.
So that is important. But even the questions comes out, you as a woman, Michelle, what are you doing for women? When really it is cisgender men who are responsible for fixing the pay gap, right? Who are responsible for fixing these issues, to Jarrett's point, right? And I'm going to use this as, this is going to be kind of a hard turn,
Amen.
but it's other individuals' responsibility to fix the issues that racially and systemically and in the massive, unbelievable healthcare disparities in the Latino and Latinx community, who are being the hardest hit right now in COVID in many communities, because those individuals are the frontline, actual tactile, touching essential workers, right? Robin, you brought up before, we're sort of all essential workers. I'm not into trying to dominate the conversation, but I work in 2 different hospitals here in Los Angeles, and one of them is extremely resource rich and very privileged and in an overwhelmingly wealthy and white neighborhood. The other hospital is in SPA 6. Those of you who are LA people know what that means, but it is in one of the poorest neighborhoods. The neighborhood is about 60% Latino and 40% Black. And I go to work at the rich white hospital, and the individuals that I work with even are, oh, COVID's not that big of a deal. We've only got so many COVID people in-house. Oh, my friend got it and she got better, whatever. Then I go to work at my other hospital, and we're coding people left and right. The census at that hospital at one point in time was 8 times the census at the other hospital. And this is a small community hospital without resources. And overwhelmingly, the individuals who had COVID in that hospital were a direct reflection of that community, and that community is Black and brown. And the starkness of this, the attitude that individuals bring to what is really happening with COVID, is directly down an A, racial line, and B, a socioeconomic line. And so in that picture that I just laid that out for you like a hammer, Jorge, can you talk a little bit about, you know, the caregiver resource group, the Latinx caregiver resource group, and your specific, you know, work that you're doing right now to support individuals who are a part of that group at Providence in the world we're living in now?
Yeah, well, thank you. I first, you know, I'd like to, because I do manage the infectious disease practices at both St. Vincent's and Portland Medical Center. You're right. And in terms of Latinos, Latinx, Hispanics, whatever you want to call us, right? Oftentimes it could be up to 2/3 of the patients that are hospitalized. And that's just hospitalized patients. That's not even in terms of those patients that, or those individuals that are affected with COVID. It's hospitalized patients. And so we do see a difference. And well, when it comes to Latinx, it's an interesting term. It's a fairly new term. There was the Pew Research Center spoke about the reality is that most Hispanics, 1 in 4, even know that the term exists, Latinx, so it's a new term. That the same article, they also say that only about 3% of Hispanics actually use it. And so oftentimes we as Latinos are very passionate, very spicy, if you will, emotionally, right? And we get caught up on all these different terms and what have you. Am I a Latino? Am I Hispanic? Am I a Chicano? Right? All these things. And they're all really great conversations. But I think it's important to understand at the end of the day, we're brown people facing a common experience. And so what we're trying to do here in the Oregon region is we're only in our 2nd year of being a resource group, the Latinx resource group. And really what we want to do is come together with a united voice. And saying that is much easier than doing that because we're so diverse. We're extremely diverse. So not every Hispanic or Latino speaks Spanish. For example, those that even are from Latin America, there's different types of dialects outside of Spanish, for example, a lot of different religious beliefs. And so trying to come to a common understanding isn't easy, but we're committed to it. And it all comes down to respect and how we respect each other and all the different beliefs, right? And so what we're attempting to do is to come together with a united voice and really begin to discuss and explore what it is to be Latinos within the Providence experience. And so we have a wonderful organization. In my opinion, I'm biased, but the best organization, because we are based off of a mission and core values. And our mission is not just for our patients, it's for us. And so then it's about how do we explore our lived experiences as Hispanic, Latino, Latinx caregivers. And it's been a very interesting, sobering, and sad to hear the experiences because they're often very similar. So we'll hear things about being passed up for promotions, perhaps how we might have to justify something a little bit more than others, or work a little bit harder. And for Latinos, working hard, and this is a generalization, of course, but there's nothing alien about working hard. Working 2 or 3 jobs is very common. And so the concept of work for us isn't something that we typically fear. But what happens is that oftentimes we are experiencing limited opportunities. And so we're discussing about how do we help develop, how do we help grow, and again, more importantly, how do our Latinx caregivers experience both the mission and the core values of the organization? And how do we then share that information in a way that could be received? Because, as you know, oftentimes things are lost in translation. For those of you that are bilingual, things are lost in translation. And so how do we do it respectfully with respecting everyone's beliefs? And so we're doing the hard work. But, you know, some of the things that we're experiencing is how, for example, patients will ask caregivers, are you legal? Or are you illegal? Or do you have papers? We've also heard things such as, and I've actually experienced this myself, where a patient said, well, I can't understand you beyond your accent. Your accent's too thick. And
your accent, you've experienced
your
it.
accent.
Yes, sir, my accent. And of course, it's how do you get past these microaggressions is one thing. But then what happens, which has been interesting, and there's oftentimes, we're speaking earlier about how we're emotionally impacted, and as being a caregiver and being a leader and being the chair, when people come to me and begin to share their lived experiences as caregivers, man, it's heartbreaking. And as you all were mentioning, it gets heavy. And, you know, and so what do you say? I don't know what to say in some instances other than to just say, I'm here to listen, right? And I wish I had an answer. But when a physician will complain about a Latinx caregiver, but the complaint isn't done for other caregivers, and when leaders will just take one side of a story, right? And because the narrative has been given, yet the Latinx caregiver doesn't have the opportunity to be able to defend themselves. And worst, and I've seen this happen with African-American women mostly here, but I have also experienced it with Latinx and I say this with all respect, a white woman in a meeting stands up for herself and she's being assertive. A black woman stands up for herself and she's being aggressive. Or even worse, what I've heard is that she's not being humble enough. And I've also heard it when it comes to Latinx males, right? That we can't take instruction from females because we're machistas, we're male chauvinists, and yet when we see it being done by others, even if it's done respectfully, it's really hurtful. And there comes a point where I think, and Dr. Henderson can speak better to this than I, is that in order for me to avoid being hurt, I'll just laugh. Or in order for me to avoid being let down, I'll just take it. And I got to tell you, I myself, and have experienced things that have caused me to have to get into some type of help. I had a director, because Dr. James, you said we'd go there. I had a director make a racial joke in front of my colleagues, 10 other colleagues, when I asked about, we needed some flyers or something to be translated. And this director said, so why? So that they can order tacos and find a radio station? So what I did is I laughed as everyone else laughed. 2 points on that. My cowardice, I accept, because I didn't stand up for it. But the second reason is because I have a mortgage and I have a family. And I cannot risk my family for my pride, which is often the Latino experience. And so when things like that happen, who in the world is going to believe me? And one of the things that have come from George Floyd is this awakening, I believe. However, how many Latinos have been murdered and it doesn't hit the news? I mean, it just the other day in Phoenix, a man was put on the ground, and for those of you that have ever been to Phoenix, oh my goodness, right? It's hot on the asphalt with the knee on the neck, and was murdered. The young Latino that was a security guard in LA that was shot in the back, right? And how many times here in Portland have we come in this very progressive liberal state with progressives telling Latinx people to speak English, or why do we need to do these things? And so all of those lived experiences, and I got to tell you, as a Latino who is finishing my doctorate degree, I will often get asked, why do you need a doctorate degree? And I'm like, whoa, wait. And this is from people that have doctorate degrees, right? So why would I need a doctorate degree? Because I fell in love with education. That's and because I have $185,000 worth of student loans, because I didn't get help because, whatever, and so all of this to say, it's all very complicated, it's all very real. And so what we're trying to do in the Latinx resource group is bring these lived experiences and then begin to share the narrative. And there's so much work to do. And if we start arguing about what we should do, what we shouldn't do, we'll never get anything done, which has been the Hispanic way for often far too long. But I think what we're doing is we're allowing people to share their experiences, and then great people like yourselves that actually get to hear a brown kid talk about my experience.
And I want to thank you so much for sharing that. Jarrett, please.
So I'm the person who's not in the medical field, right? So like I see this through a different lens, and it's interesting to me to hear these different perspectives, because we hear Michelle, for instance, talk about, we're a pretty good organization and we do pretty well with diversity and inclusion. And we hear Jorge talk about these really egregious situations that have happened, right? The things that people have said to you and the ways that they impact you. And I think it's so important to recognize, like, I can't think of a single study that has been done about diversity that didn't come back saying like Companies, organizations, groups that are more diverse tend to be more effective. They tend to do better work. They tend to, grow bigger. Even if we look at this in film and television, which is obviously my area, we see that when films and television shows are more diverse, more people tend to watch them and they make more money. We know that when radio shows and all of these different things tend to be more diverse, they tend to make more money and people tend to watch them more. But we know that diversity and inclusion is so important. And so when I hear Jorge talk about having heard this kind of moment about tacos, or talking about his accent, or talking about having to make the decision about, whether or not to speak up, I don't think that cishet white people often think about what it does to someone when it just chips away a little bit of yourself when you hear someone say something like that to you. It just chips away a little bit more and a little bit more and a little bit more. And then the more you go to work and you hear these things and you see these kinds of things, and the patient doesn't want to come to you because you're Black, or the doctor doesn't trust you because you're Latino, or whatever it is, like, it continues to degrade a person, right? It makes them feel less and less effective and less welcome. So when we see these instances and we're talking about diversity and inclusion, these are the reasons that it's so important to be able to see these folks, to see more people like ourselves when we're at work, to feel more included, to feel more seen and heard, to be able to use these pronouns, to be able to find the right words to use. This is why it's so important.
And it's incredibly important. And I think it's also, Michelle, it looks like you were going to say something. I want to give you a chance to speak as well. Beverly, I also kind of want to tee you up as well as the official HR person in the room. And, I got to give you that opportunity, because Jorge also brought up that Black women get treated so incredibly different everywhere, including in the healthcare space. And so you are at a very interesting intersection as well of, I don't want to speak for you, but possibly having had similar experiences to Jorge as a Black woman, and also being HR in the organization. So I kind of want to know how you think as an organization, as Providence, those people who are watching who are part of Providence, can start to say, okay, you said that, and we're not going to do that anymore, and what those official channels are within the organization. So I'm teeing you up, but Michelle, go ahead. You had some thoughts.
Well, Jarrett mentioned, how these things just kind of chip away at who you are. The word microaggression is absolutely perfect, because it feels like these little nips are coming out of your skin and bone and sinew the more and more they happen. And, after a while, you get to a point where it's like, okay, I can't function anymore because I'm being attacked, because that's what it feels like after a certain amount of time. Jorge, James, you mentioned, Black women being treated differently within the workspace. I've had a number of experiences, none of them at Providence. I can say that, in my 19 years, I've never had anyone do some of the things that you hear about in some work situations, like coming up and touching my hair. I mean, who does that? It's like, don't.
Unfortunately, a lot of people.
Exactly.
Right.
Exactly. But yeah, like touching my hair, or saying, well, you should probably be a little less forward when you say something, because you're coming across as being aggressive as opposed to assertive, and winding up being that difficult person to work with. And so I'm happy that I haven't had that experience, but Jorge, to hear the experience that you had and to know that that's happened at Providence, it just breaks my heart. But we have to do better, and we have to be. I'm hoping that the zeitgeist that has happened within this country, within the organization, has reached a point so that if something like that were to happen again, you would be able to say, no, and we're going to go deal with this, and not wind up having it have negative repercussions on you. So,
No, thank you. And if I just quickly might just add is that, it's not about anything else but about safety, right?
Mhm.
And again, it's happened. As I premised at the beginning, I love my job. I don't want to get fired because I'm talking real, right? But
Just blame it all on me, Jorge. I brought it out. Okay, it's all on me.
There is a lot of fear, and the very small examples that I've provided are just a few, right? And yet, but I gotta also say, the promise of our mission and our core values is what keeps me here, right? Because I could have gone into for-profit, but I've chose not to because I love what we're doing. And there's great people like Dr. Henderson. I mean, the first time I met her, it's like, oh my goodness, right? Just fell in love. We connected right away. And yet, so there's a lot of great people here. And I could tell you that there's a ton of great people. And I would just say that there are a few instances, but I think if we're going to make this a better place, we have to be able to realize a couple little things really quickly. Physicians are not always correct, and they make mistakes as well. They have personalities, they have biases, just like everyone else. So before decisions are made, those microaggressions that happen every day, those little things, as Jared was saying, it breaks you down. And so before you accept the narrative, you, the royal you, whoever the plural you is perhaps try to find the truth. Now, it's much easier to get little snippets, right, on the news or from someone that complains and complains and complains, because where there's smoke, there must be fire. Well, not always. And one of the great things that has happened in our country is, unfortunately, it took George Floyd and others to perish. But finally, people are understanding that these aggressions of people at the park that will call the cops because a male of color is there, right? And so finally, people are realizing this stuff does happen. And my hope and my prayer is that at Providence, we would continue down the path of our mission and our core values to find the truth. And I think we're going to get there, and we have great people that could help do this.
I want to give you a chance to sort of speak as I teed you up before in this really, really fascinating, interesting conversation. Please.
I think we first want to remember that Providence is a part of the larger society. So whatever you're going to have out in the larger society, people bring that stuff to work, and we try to hire the best quality nurse, but I don't know that we necessarily vet that person for their personal views. And so I often talk to people about inappropriate comments, racist comments, sexist comments. And what I try to do is frame it within our core values. So I will ask the question, whatever behavior you were engaged in, let me know which core value you were supporting. And I will often ask people, did they get a check? Because we're paying you to follow our core values. We didn't ask you to bring your whatever in the door. You
Preach,
can
Beverly.
outside, and after the workday, I have nothing to do with what you do when you pick it up outside my door. But when you come here, you're paid to be courteous. You're paid to be kind. You're paid to know me, care for me, ease my way. You are paid to support every core value. And if you do that all day long, every day will be a great day. But when you think about your behavior, right, before you say it, before you do it, just for me, say, which core value am I upholding with this behavior? And obviously, everybody doesn't do that, or I wouldn't have a job. I wouldn't have this job security if everybody behaved that way. But I do think our leaders are telling us, Rod Hochman issued some statements and talked about the 7 things that we can do. We're talking about bringing mobile voting into the hospital so that our caregivers can vote. You don't have to leave and lose money or leave the bedside or whatever the case may be to vote. I don't think Providence is perfect, and believe me, I've spoken out and said that we do have instances where people are not appropriate, where they're not doing what they should be doing. And I mean, I personally have experienced this is not at Providence, but I remember, and I'm a seasoned person, I remember working 20 years ago, and I happened to be an assistant professor, and I was walking to the bookstore with several of my colleagues who happened to all be white Americans. And we were deciding what door to go in, and I said something like, "Oh, let's go in the back." And one of the gentlemen said, "Oh, they let y'all go in the front door now."
Oh.
And I said, and this is my 20-year-old self, because my seasoned self probably would not have reacted this way. And I immediately turned and said, "Who are you talking to?"
Mm-hmm.
Like, "Are you really talking to me right now?"
Mm-hmm.
I said, "Okay, I'm going to need to leave." And I left because I knew I would have not been the most professional person. And I went back to my office, and I guess, he thought I was going back to the dean's office, because the dean probably 10 minutes later came and said, "What happened? Are you okay?" Listen,
Good.
I'm tough. It's okay. I just needed a moment to collect myself and say exactly what you said, Jorge. Look, I have kids to take care of. I need a job. I'm going to approach this the professional way. And I'm trying to remember if I ever spoke to that man again, because that would have been my 20-year-old self. And I don't think I ever entertained him again while I was working there. But I just say that to say that having a place like a Black caregiver resource group to share those common experiences, because I didn't get to be the chief human resource officer without listening to all those microaggressions. I can tell you that one time I applied for a job, and I happen to have a law degree, and applied for a job, and a woman applied who happened to be a white woman, and she has a high school diploma. They gave her the job, and then I was good. No, you have a right to award your jobs to who you would like to, but then try to call me and explain why I should be okay with it. And I found that pretty amusing. I said, you give the job to who you want. It's your job. I can accept that. But then don't call me and try to, make sure that I guess I'm not going to sue you, or I'm not upset, or whatever that is. To me, that was the microaggression for people. I don't have to buy into your version of something, and don't try to make me do that. And so for me, I think being able to share experiences like that with young folks and with other people help you to know, no, it's not your imagination. You're not the only one. I still believe that what I say reflects who I am. So I'm not going to curse you out or, be inappropriate. I'll let you know what I have to say. I guess most people who know me would tell you, if I have some concern with you, you probably know it, because I probably have shared it with you. Right. But I also say to people, and Jorge, go to HR. That's my job. If you bring something to me, I can't say, "Oh, Jorge, that's okay. Just let them talk to you." I have to address it, right? And also, you have integrity line complaints, and you have the caregiver resource group. Because yesterday, there was a Black man shot in LA, and several colleagues called me throughout the day to say, I had to go home. I'm mad. And yesterday I was at home, and I said, I am at home and I'm mad too. And we talked it through. We kind of talked about, okay, this is where we are. We talked the whole situation through. We called a couple of other people, because it didn't feel good yesterday. It really didn't. We were in a place where we were saying, okay, when are we going to stop? And you get to the point where, and I hope that colleagues will listen to this and hear this with the heart that's given. I don't ever want anybody to think that I am in favor of tearing up things. But things are not as important to me as lives. So when you keep coming to talk to me about the things that people are tearing up, my heart gets so sad because you're more concerned about the things than you are about the 7 shots to the back, about the dead person. And I just want to say, because this has been on my heart for a good little while, I don't want to tear up your things, okay? But I also don't want people to kill people. Mm-hmm. And if I had to get a scale, the killing is so much more impactful than what you're tearing up. Build it back. Get your insurance, do what you need to do, but let's have a heart for people. And I want to end by saying, I think Providence is getting there. We're not perfect. And I'm going to have caregivers who come to me to talk about what other caregivers have done. But we're in spaces where they're allowing us and even encouraging us to have the conversations. And I think that's step number 1, because I have worked many places. As a Black woman, I have worked places where I am tolerated, and I now work at a place where I'm celebrated, and it is a completely different experience.
Amen, girl.
Yeah. Wow. Beverly, that was tremendous to hear. All of it, but you put such a great button, as we call it in the radio world. You put a button on that in that you have worked at places where you are tolerated, and now you're working at a place that you are celebrated. And I think that is truly tremendous. And I certainly hope, I want all of you on the panel, by the way, we're going to close up here. I want each of you, I'm going to give each of you about 10 seconds, just from what we've talked about here, how we can take these words, and for the individuals watching, what are next steps? How can we turn this into action? How can we continue to progress forward? So from your own perspective, what is that one thing that someone can take away from this conversation? And I'm going to come to each of you, but what's that one thing someone can do next to help push the conversation forward and make progress? And while you sort of think about that, I do want to say that my sort of thought about this is that I hope we get to a world, because I feel like every person of color has had to go through this. I hope we get to a world where we don't have to make that decision in the workplace about whether or not I speak up about something or whether I pay my mortgage and feed my kids. Because the fact that I don't know when that happened to you, Jorge. I'm not sure when, Beverly, your experiences happened, but that's happening to people still now in 2020, even in the middle of the uprising that's going on right now. And this is my words, not Providence words, my words. I've been calling this the Great White Awakening. Like, this systemic racism has been here for a very long time. White folks are just now getting awoke to it. So during the Great White Awakening, I am elated to hear that we do have that progress. Like someone like Beverly, who is clearly the right person for the job, right? And a very well-educated woman who is doing her thing and can say, I work at a place where I am celebrated, rather than someone treating you the way like the stories that Jorge said. So that is my hope, and that is my wish. Everyone who is watching, we want you to be able to take something tangible away from you, away from this conversation. So this conversation is all about sort of, how do we keep it moving forward? How do we fix these things? If all of you have had a chance, Dr. Robin, I'm going to come to you. If you just have sort of one final quick thought, like 10 seconds, about what are this next step for the people watching that we can take moving forward from this conversation.
Well, I'm going to go back to something we talked about very early on in that piece of self-care, but I'm going to take it one step further. Part of self-care also is reaching out to your fellow caregivers. And wherever you are, what are you going to do every day to touch somebody and say, how are you doing? And then listen. And whether it's a caregiver you know well, or a caregiver that you're just interacting with for the very, very first time, take the time every day to say, how are you doing? And then listen.
Thank you. Thank you very much. Peter?
I think something that's really tangible and that we're exploring at Swedish and some of the work is just using pronouns as your introductory in all of your spaces to normalize that we live in, a world where people identify differently, and to make that apparent and an open, safe space. Think about incorporating that within your email signatures, in your Zoom profiles, in all of your social media profiles, but most importantly at the workspace, so that it can be normalized in the sense that we can create that space of inclusivity around gender identity.
I love it. Thank you very much. Jorge?
From a human dignity perspective, just believe people's lived experiences.
Which you would think would not be difficult, right? you would think that would not be something that we would have. Please believe me. It's a thing I've been on lately, by the way. When Black people or people of color or queer people tell you that something is wrong, just believe us. Just start with that, and then let's have a conversation from there. Michelle, final thoughts?
I think if we have the ability to go and speak with someone who we engage with, who may be in a leadership position, just to help them realize that this is something that needs to continue to happen. We're not just saying, okay, after the summer, everything's going to go back to where it was. And like, no, there has been a shift, a tectonic shift, and we need to make sure that we are continuing this conversation and continuing to move it forward.
Excellent. Very good. Beverly?
Really quickly, Peter gave me this one and I wrote it down. The use of pronouns in policies. I'm going to go back, Peter, and look at that and see what we're doing with that, because I think that's important. And that took me to another one, names. If you don't know how to pronounce someone's name, and this makes it very simplistic, please learn how. I'm seasoned, and I've told my children, if these are your friends, you don't need to shorten their name to make yourself more comfortable. Just practice pronouncing it. And in the workplace, don't shorten people's names to make yourself feel more comfortable. That's their name. That's what they identify as. So please use people's names, because that's one of my pet peeves in the workplace. And last but not least, let's ask each other about our experiences so that we can have these conversations, so that we don't have this gap. And I call it make stuff up, MSU. You have this gap, you haven't asked the person, so you make stuff up. Ask me about my life experiences, and you may find that they're really eerily similar to yours, because there's a lot more we have in common than we have differences. And then I just think, if you have any love in your heart for human beings, bring it to work with you and show people some love, and we will have better days at work and in life.
All of that. Jarrett, can you top that?
I'm leaving, so I don't know how I'm supposed to follow that. I will say that one of the things that's really stuck out to me here, there have been many different things, and it sounds like the folks at Providence have had a lot of great experiences. But I would also say that the thing that I always walk away with from these conversations is wanting to see organizations and companies focus more on training, because I feel like training's about anti-racism, anti-Blackness, and all of the various different antis are so important. It's not only about wanting, like, we're looking at the Black Lives Matter movement, if you will, that kind of really sparked a lot of these conversations. It's not just about our lives, but it's also about our livelihood, right? Because I left my last job because of the racist person I didn't want to deal with every single day anymore. That was really having a major impact on my day-to-day life. No one should have to leave their job or be considering whether or not they can pay their mortgage because of discrimination happening in the workplace. Like that should happen nowhere, right? And so as Michelle said, like this isn't going to be over at the end of the summer. Black folks are not going backwards, right? Queer folks and transgender folks are not going backwards. Women are not going backwards. Marginalized groups everywhere are not going to be going backward. So everybody else has to pull up and get better. And so I think when we look at how we go forward from this moment, it's not going to be about, well, I hope that things can go back to normal soon. Nobody is really interested in things going back to normal because normal is what pissed people off in the first place. But we need to be really thinking about how we can get better, how we can be stronger, how we can be more inclusive, how we can be more diverse, and how we can embrace the fullness of who our organizations are, our companies are, our friend groups are, our neighborhoods are, our communities are, so that we can all be better and have a better time when we're existing in the world.
Beautifully said. And I'm not even I don't even have closing thoughts after that. Everything that you guys said as closing thoughts are really, really tremendous and powerful. Honestly, it's just my job to thank each and every one of you watching right now and listening to this, that you have been a part of this conversation. I think we went a little longer than we originally intended to, but I think we went there a little bit. We got in, we got a little comfortable and a little bit, especially when talking about a large hospital system and corporate America, man, there are not a lot of institutions willing to have these types of conversations about their own institutions. That should tell you a lot about Providence and the fact that we are having these conversations, that this is a series of conversations, right? It's not one and done. We keep going. We're going to keep having these conversations. You'll see some information coming out about voting. Like Beverly was mentioning before, there's going to be a lot around that coming up this fall. So big ups to Providence for having this conversation. Thank you, Dash Radio, as well, for hosting this conversation and for being a continued very, very integral partner with Providence as well. And then, of course, thank you to all of the panelists here as well. I learned a lot today, and I like to consider myself a pretty learned person, but I learn every time we have these conversations. And
You see you, new doctor.
Right, the doctor learned some. Very good. At that, with that note, the very last thing for any of you watching, if anything that we talked about here was triggering for you, particularly in terms of your mental health, if you are feeling depressed, you are feeling suicidal, there is help for you. There are resources for you. They're not always Providence resources too, by the way. This is not a Providence thing. This is we're here to help you. So if the racial aspects of these conversations, the gender identity or sexuality aspects of these conversations, the mental health aspects of these conversations were triggering at all for you, or you just want to talk more and you need help, there are resources in the comments below on whatever platform you're watching this on. Use them. You can text people, you can call people, any of that. The help is there for you. And I thank all of you for watching very much. I thank you, panelists, for being here. The conversation continues, y'all. Take care.
Yeah, take care.
Be well.
Bye.